everybody. Welcome back to Pelvis Party. My name is Becky and Dr. I'm the owner of Rochester Local, and today we have Annie Jurrens as our special guest on Pelvis Party. She owns a shop in Plainview called Refill Goods. And of course, our familiar face, Dr. Richard. She is the division chair of hospital and surgical services at Olmsted Medical Center. And today we're talking about hysterectomies. Annie had a medically indicated hysterectomy. Hello, welcome to Pelvis Party.
Hey, thanks for having me.
I'm very excited to have you. Annie and I are friends. We've been friends for quite a while. But I did not know the reason why you're on the show today. I had no idea.
Yeah.
And so it wasn't until Dr. Richards, who is your provider, said, hey, I have this person. And I was like, well, I know her. So it was great to make that connection. And today we're talking about hysterectomies. Yay! Hysterectomies. And you had a hysterectomy this year, earlier this year. And it was a medically indicated hysterectomy. So tell me about that. What does that mean? There you go.
Do you want me to do the medical jargon portion of it?
Yeah,
for sure. For sure. Okay. Sometimes I feel like a broken record regarding this, but I'm going to just keep doing it.
Yes, please.
So understanding what is a hysterectomy. A hysterectomy is removing the uterus that includes the cervix typically. So the cervix is like the lower portion of the uterus. It's not like it is. It's kind of like if we were going to remove your leg, what about the foot? It's like, it's the lower limb. It's part of the foot is part of the lower, like it comes with it. Your fallopian tubes are the highway where a sperm and egg like to meet.
Yeah.
No hormone in those. Removing that is called a salpingectomy.
Okay.
We're doing a lot of prophylactic salpingectomies now because we do believe there is a reduction in ovarian cancer risk by removing fallopian tubes.
Okay.
So oftentimes when we do a hysterectomy, we also do prophylactic, essentially salpingectomy if we can to reduce that risk.
What's prophylactic?
I was gonna say.
Oh, sorry. Just killing your vibe. Killing your vibe. Apologies. I was just trying to do that.
No, it was good. That was great. It was great.
What's a prophylactic?
What is a prophylactic? A prophylactic salpingectomy means we're removing the fallopian tubes. There's nothing wrong with them.
Yeah.
But what we're doing is we're thinking future because we're always thinking future, right?
Right.
As a risk reduction procedure at time of doing the hysterectomy. So if I can remove your fallopian tubes safely in a way that I feel safe, I'll try to remove the fallopian tubes. Typically, 75 to 90% of the time I'm able to remove the fallopian tubes. We think some ovarian cancers actually start in fallopian tubes, hence the risk reduction in removing the fallopian tubes at time of a hysterectomy, which is removing the uterus. We're leaving the ovaries the vast majority of the time. And the ovaries are where the hormones are. That's where the estrogen is. We know that our ovaries are releasing estrogen that keep our head smart, our heart healthy, and our bones strong. So we really we think real hard before we remove those ovaries, especially in someone who hasn't gone through menopause. The average age of menopause is 51 to 52 years old. That's enough fun facts.
Okay, so Annie had a hysterectomy. And so she had her uterus and her cervix removed all together. And tell us a little bit about what led you to this decision.
Yeah. So I am 34 years old, which seems a little young is what I would have thought. But I have had 3 kids. I have got good use out of my uterus. I was on birth control at for at least 10 years between the kids. And then I had tried an IUD and I really didn't like it. It made me really anxious. And the insertion process was awful. And then taking it out, I didn't like that either. So I really didn't want to go through that experience again. But also I have a family history of hysterectomies. My mom needed hers out. My sister needed hers out. So I kind of figured it would happen eventually. And then my periods just started getting worse. And so it was just like more and more. And so I don't know, even though it'd been 20 years since I was getting them, I never really figured out when they were going to be coming. So I just was never good at planning it. And then I kept, waking up and I was like, did a mass murder happen here? Like, what is going on?
Terrible.
Absolutely.
And so like all that, and it was just like, I'm so glad we're talking about this because I feel like so many women, especially now that I've been talking about it, I just have no idea that there are things that can be done to help. So so that's kind of what led me. So I was meeting with my primary care doctor. Dr. Mackenzie in
there
Plainview.
we go.
We love Dr. Mackenzie. But I was meeting with her. My iron is also really low. So, and it's always been kind of really low.
Wow, I don't know anything about that. Yes, I do.
So low iron. And it was just like, well, that it's probably losing that much blood. It doesn't seem to be helping that situation. So I was like, okay, I'm ready to go meet with Dr. Richards. I was like, I'm ready to start this conversation. So, that's how we got there. So then I went in, had my appointment with Dr. Richards. Best appointment I've ever had with an OBGYN.
Wow. Doesn't surprise me. Doesn't surprise me.
I've had 3 kids. One of them was born in another country. I've had a lot of people. But by far, best appointment. I went in and she's like, great, tell me about your periods. And then she told me all of my options, all of my hormonal options, she drew me a picture. I just found it the other day on my desk.
We like pictures on Pelvis Party. We really like pictures. It's been a while.
Yeah,
so we like pictures.
Great. She did a picture. She wrote down the acronyms and explained all the different things. And then after she explained everything and she was like, pros and cons, pros of this, your period's really, light, but also you want to punch somebody in the face still every, once a month, all these things. It was just very wonderful. And then she said something that I've never heard a doctor say. What do you think? What do you want to do? Which I very much appreciated. And I said, I do have a family history of needing it out. I figured, if I don't need it, especially if the ovaries stay, if it's not really, doesn't seem like it's going to change my life in a negative way.
Right.
It just means I don't have to have periods constantly and for an indeterminate amount of time. I just don't see any negatives to this. And she said, great, let's make it happen. So the thing that surprised me the most was how quickly we were able to make that happen.
Wow.
So the next week I went in for an ultrasound and they're like, yep, looks great. And then it was less than a month before we had that surgery. And
bing, bang, boom.
Yep. And there it was.
Bing, bang, boom.
Yep.
So, we talk a lot, or we hear a lot about a hysterectomy, and I mean, there's a lot of trauma that happens to the body when you remove an organ. And recovery time, right? So, truth time. What was recovery like?
I was so tired.
Okay.
So at first when it happened, it was like, do you want to spend the night or are you going to go home the same day? And like, technically I probably could have gone home the same day. And that's kind of what I was thinking, but I'm really glad that I didn't because for it, there were so many fluids like pumped through me. So all night I just had to get up and go to the bathroom.
Oh, sure.
And so it was so nice being in the hospital room that I could call, and I was also still highly medicated. So just to be able to press a button and be like, hey, I need to go to the bathroom again, and then like they unhooked me and we waddled over and back. And so that my husband, I didn't have to keep waking him up all night that first night. So I think that was really good that I stayed. And then I went home the next day. And then I basically didn't leave my bed for a week. I caught up on a lot of good shows.
Perfect.
You can look at my Instagram highlights. These are all the things I watched
while
I didn't leave my bed for a whole week.
Perfect.
Because I was just exhausted. But then I had so it happened on a Friday. So I had a full week in bed, and then like that next Monday after that, I had an appointment for my kiddo to get her ear tubes in. And like I didn't want to miss that. And I was like, cool, like I'm not on narcotics anymore. I should be fine to drive. I was not fine to drive. I should not have done that. It was fine. I mean, I could do it. But then I got home and was exhausted
Too
that
much.
day. The next day, exhausted. It just like knocked me out. And I was like, oh, that was not a good idea. So I didn't realize that. And then kind of that next week, I went back to life as normal. Like went back. I'm like, I don't have a job that I'm like up doing a lot of different. I could just sit if I want to. So I did that. But by Saturday, I was so tired. I was like, I had a couple of meetings. So I was just like, okay, my husband was there. I was like, you just let me know when they get here. I'm just going to close my eyes for a little while.
So question for you. You pushed yourself too hard then that first week.
I did. That second week, I pushed myself too far. And I don't know if
You never hear this, do you? You never ever hear this from high-functioning, very busy women, right?
Yeah, I was just like, I was in bed for a full week. I'm fine, and then I think it was that Saturday, too, that I was so tired.
Yeah.
That I was like, nope, I'm going. It'll be great. I want to meet with these people. I'm going to go. I'm going to try. And I backed my car into the garage. Well, I didn't wait for it to fully
because you
come up. I was like, yeah, I gotta go. And then I was like, yeah.
Oh,
and and I was like, Seth, I made a mistake. Will you go fix it? And he did, and it was fine. And he didn't give me a hard time about it. But it was also, I did that when I was pregnant. I did that when I was, anyway, should stay away from cars when I'm very tired. But it's fine. So yes, I did push myself too hard that second week. But then I was fine. And then I had my heating pad, and I carried that with me for a long time. I still use it a lot because I'm like,
there you go. Why not? It's cozy and comfy,
nice and cozy.
Right? Everybody should have a personal heating.
Yes, so I did. And there was one time I must have been using it or carrying, I don't know, the wires, it started to spark and and I was like, bah! But I immediately went to go get a replacement. I was like, I can't do anything else until I have my heating pad back.
So, we've talked a lot about fatigue, and that's something that I didn't always initially talk to patients about. I really focused on the lifting restrictions and whatnot, and bleeding and expected spotting and bleeding after a hysterectomy. That's completely normal. But it's a huge trauma to your body, as we said earlier. Like, it is trauma, and your body needs to focus energy on healing. A lot of patients are similar to you, where they're anemic. They're anemic or low iron, because every month they bleed out, and then restart. So the body is working really hard to work up those iron levels, as well as heal from a major surgery. You don't have any incisions on your belly a lot of times, but your body's working really hard. So fatigue is very common, and it gets better and better. We see you at 6 weeks, and I'm like, how you doing? Tired, but it's getting better, right?
Yeah,
so you're super normal.
Yeah. And I thought the whole time that I was recovering, I also thought, I'm really tired, but this recovery is so much better than having a baby. I was wearing normal underwear right away. I was not up in the night with an infant.
You got to spend a week in bed. It's like a vacation.
I could go to the bathroom normally. There was all these different things. I was like, oh yes, but this is so much better than having a baby, and the recovery from this is so much better. So
absolutely.
Okay, I have 2 funny questions.
I can't wait. All right, let me mentally
How big is a uterus when you take it out?
Oh, interesting.
Oh my gosh, I love this question. This is a really good question, Becky. Okay.
And is there a standard size? Or are you like, wow, that's a honker? Or like, whoa, that's teeny? What is
right?
Great question.
Think of what a uterus does. It holds humans oftentimes at a different period of time. So what I refer to as a cuterus.
A
little bit, I've had little uteruses that are this big. They're just little guys.
Yeah.
Those are usually people who've gone through menopause, and it's not really, it's there.
She's shrank.
Yeah. Okay. And then anytime a uterus is greater than 250 grams, that gets my attention. So the largest uterus that I've removed vaginally was 980 grams.
Wow.
So almost 1 kilo. Exactly. So I'm a magician.
Yeah. Wow. And you just said something really fascinating. The uterus is removed vaginally.
Yes.
Sometimes. Mine was. But sometimes.
Not know this.
Ooh, breaking news.
Oh.
I feel should I be embarrassed that I did not
not
know
at
this?
all.
Okay.
Totally.
I did not. I thought that it was an incision.
No. So there are a lot of different ways to remove a uterus. My preference, I like to pride myself in being a vaginal surgeon. So I try to go with the least invasive procedure humanly possible.
Yes.
So I start typically with a vaginal hysterectomy. So no incisions on the belly. Everything comes out the vagina. Lots of tricks and a lot of training to get to that place. Next would be laparoscopic. So small incisions.
Yes. Okay.
And then laparoscopic can be what we call standard straight stick, so like this, or robotically. And then finally, if we need to, our backup is always use either a C-section incision called a fan and seal incision, or an up and down incision.
Okay.
And sometimes we have to do that up and down incision, especially with some of those larger uteruses. And there are certain things that needed to happen for me to take out that almost 1 kilo uterus.
Oh my gosh.
Vaginally, vaginally. Otherwise, a lot of times very reasonable to do that abdominally.
Okay.
Yeah.
Wow.
So again, we're going to go TMI.
Right.
Where
Perfect.
this is what we're
we
all
love
about.
It. That's what this show is about.
What really sold it to me is not only could she take it out vaginally, but she could, again, 3 babies, big babies. She could also kind of do a little work to tighten some things up in there.
She did a little zhuzhing.
Yeah.
Oh, wow.
So I was like,
done.
yes, that sounds great. And I was like, yes.
Wow, I love that. So this is all very interesting news to me because I did think that it was all via incision or laparoscopically. So it sounds like after your recovery, you dealt with some fatigue, which is so normal. But right now, you are sitting here and you feel great about your decision, and it sounds like this was definitely the path for you.
It was definitely the path for me. I'm very happy about it. I still have like in my calendar a reminder that like your period maybe will start today. And I'm like, ha, no, it won't. Yes, yay.
Yeah.
But really, when I went in, even when they handed me like the cup to pee in, they're just like, the person was like, this is to get you ready for the best day of your life. And then after that, after it was done, it was just like, oh, this was such a good decision. Like every medical professional, everybody I interacted with at the hospital and after. I mean, even my sister's an ER doc and ER nurse, and she texted me. She's just like, I hear you're having the best surgery ever. So I felt very good about the whole thing. Yeah. The recovery was great. It was all, I would recommend it.
Amazing.
You know, so good.
From a clinician point of view,
what I love about Annie's story, Becky's story, my story is we all have the same problem.
Right. Heavy periods. Right.
Periods. Yeah. And we all have gone on different journeys. We are all in charge of ourselves. And what works really well for Becky, Annie, me, you know, is different. And that's okay. And that's great. Like the answer 30 years ago was hysterectomy. The answer today can still be hysterectomy. Yes. It is a huge portion of your life. Yeah. It's usually 1 week of bleeding. Like, don't settle.
Yeah. Don't settle. That's what we say here. We say it every episode. Don't settle. Figure out your options. Figure out what's best for you. And you have choices, you know, and that's very, very empowering. And that is what is so great about OMC and all the physicians and clinicians that we see. So, Annie, thank you for coming on. And frankly, talking about something that's really personal and vulnerable, and you sharing your story is empowering for others. So I really appreciate you coming on to share. And of course, thank you for doing a good surgery.
Yeah, we did it. It's a partnership.
Right. So anyways, thank you so much for joining us on this episode of Pelvis Party. If you'd like to see more, please head to rochesterlocal.com/pelvisparty.